Honestly, I cried. Even on the way from my house to hospital in the ambulance, I was also crying. Hi, I'm Naqiah. I'm a COVID-19 survivor. It has been 7 months since I've been discharged from the hospital.
Hi, my name is Alia. I am a COVID-19 survivor and it has been around 2 months since I have been discharged from the hospital.
So when I was tested positive for COVID-19, I was really shocked. The first thing I felt was speechless, and I felt really scared because at that time the MCO just started. I was at home with my dad and also my husband and my brother. I did not quarantine myself in the room because I did not know I'm having a COVID-19 at that time. The feeling was mostly scared for them.
When I got my result, I was scared because I didn't know much about the virus. And at that point, I was really worried for my family. My husband, he got tested first. He went to the private clinic around this area, and when he was positive, we decided to test the whole family. I think I cried. The moment my husband was positive, I cried because we were already separated. We already told him to quarantine himself in the room. We knew that hospital was going to take him, so I was already crying at that time. I just told the children that Daddy's gonna go to the hospital just for a few days. My 6-year-old son, he definitely asked a lot of questions. He was curious. I had to explain all the way that the ambulance are coming, that we had to do the swab test.
Wait! Before you continue on watching this video, make sure to subscribe. Subscribe. Done? Thank you guys. Now let's watch.
The symptoms I experienced was fever, coughing, lost sense of smell, diarrhea and vomiting, and a major headache. Before I get tested for COVID-19, I did went to a clinic a week before, and the doctor just diagnosed me as a normal viral fever. And then my symptoms later on persist, and it became worse until at one point I started to vomit. That's when my husband decided to take me to a private hospital. I did not have any direct contact with a positive COVID patient. I did not have a travelling history, so being positive COVID-19 was really shocking.
Before I got tested, I never had any symptoms, but after we got discharged, I got that side effects of loss of taste and smell. It was just me and my husband. We lost taste and we lost our smell, and anything that we eat, we couldn't taste it, so it was quite depressing. I got it back after a month, so it was quite long. My husband got it later. My smell and taste, it went away slowly. I felt that why can't I smell like I used to? It was frustrating because you can smell but only a tiny bit. We recovered our sense of taste and smell gradually. It didn't came back like all of a sudden to us. It definitely came back like a bit by bit.
I believe I got infected from the virus via sporadic. The doctor did contact tracing. That's when we concluded it was a sporadic cases, meaning I might have touched a surface, which I suspected was from my previous workplace.
We believe it was first my father, and then my mother, and then my husband, he went to visit them. So he got it from them and then later infected all of us. So all of us had the virus around the same month in October.
When I first arrived, they put me in the hospital Sungai Buloh. So at first, of course, I felt lost because no one came over to brief me or anything. So they basically just sent me there. And that's it. They just give me a change of clothes. Honestly, I cried. Even on the way from my house to hospital in the ambulance, I was also crying. I was in the hospital Sungai Buloh for I think around 5 days. Then they moved me to a low risk center because the only symptoms I had was coughing. New patients have more severe symptoms, so to avoid me catching another bad symptoms, they put me to a low risk. Okay, this time I felt really down because it was a one patient per room. So imagine being 24 hours alone. No family members can actually visit me. The only communication I have with them is via phone.
At the hospital, it was quite scary because I had to juggle taking care of my baby and also taking care of my 6-year-old son. It was definitely stressful. When we were at the hospital, they did all the health checkup. Everything was okay, but my baby, there was a blood reading test that was a bit overboard. It has something to do with her liver, like the liver blood reading. It was quite high. It was above average for her reading. So they had to take her blood test almost every day. All of the testing and like the blood tests, that was quite difficult for a mother to try to tell your child that you need to inject something to get the blood out of you. And my son, he was reluctant to do the test, so we had to have help. The nurses had to hold him, so it was difficult for me to watch because he was really scared of the needles, but I knew that we had to go through it. I just had to like explain to him that we need to do the test. It's very important to make sure that the virus are all gone. I mean, when you are being put in a situation, you definitely would just do what you have to do. So.
My mental health was, sometimes I was feeling okay, and then sometimes I would feel very down, and then I would cry. I think I cried almost every day. Being away from a family and then staying at the center, it feels like asrama, you know. It doesn't feel like homey at all.
It just makes you feel lonely because I have my children, so I was quite lucky. I didn't have time to like panic or get sad or depressed because I just wanted to make sure that they were comfortable and they were getting better. So I would say it was fine.
Okay, in terms of work, I was retrenched while I was warded in the hospital. My husband just said to me just to take my time, so I decided to actually not to seek for any work first. Having experienced COVID, right, you don't know whether you will come back in one piece or healthy or not. So it gave us a few perspectives in life, like what's the most important thing in life.
I am quite lucky because I'm not working at the moment. Adjusting back to my personal life was, I would say, just pretty easygoing right now. But I was separated from my husband and 3-year-old son, so reuniting with them and having the whole family back together again was really good and a relief for all of us that the ordeal was over. But so far, I would say before and after COVID, it has been the same for us.
The biggest misconception is after 14 days, we are not infectious towards others. So please bear in mind that we do not have some, contagious disease. It's just that within the first 14 days, yes, you can actually infect you guys. But after that, no.
So the biggest misconception, I think, is people are probably scared because they probably think that we can still be carrying the virus, or we might still be continuing the chain because we had contracted it before.
I learned that you cannot control what's going to happen to you. You cannot actually control the other people around you. You can only take action for yourself, motivate yourself, because it can really bring you down. Yes, COVID-19 can do that.
I learned through this experience, although I could not ask for any help physically, there were definitely a lot of people who wanted to help us during the ordeal. All of our family and friends, they reached out to us, they made sure that we were okay, and everyone was ready to help us. And it just made me realize that although I am in it by myself, I was not entirely alone. And also the doctors and nurses, they work really hard to treat and take care of us. I definitely feel that we were in good hands and I felt safe.
My message to everyone out there is please take care of yourself. COVID-19 is a serious issue. It's not a controversy, not some agenda. No one is doing this. Please follow the SOP. Trust me, being a recovered COVID-19 patient, I do not want to go through that again. That is like one of my nightmares. If let's say I was COVID-19 again, I don't think I would want to experience that again.
As a COVID-19 survivor, I would say that if you are scared, you are not alone. This virus is new, that's why it's scary, and we don't know what kind of health problems that can happen to us. But the doctors and medical staff, they are ready to help us, and I feel that help is everywhere. Just make sure that anyone who feels like they were exposed in any way to the virus or have any symptoms that makes them worry should just go and check, so that you will get some peace of mind and you are not alone if you are going through this.
My producer asked me to say, if you enjoyed this video, don't forget to like, share and subscribe. And you can subscribe here. And then the Seismic TV got new channel. Don't forget to subscribe here. Yeah, thank you. Yeah. Sorry. What, is that okay?
Is it though?
I don't know.